Which filler should one use? A commonly asked question. First of all, the key to understanding what filler should be used is understanding anatomy. First, know the plane where filler should be placed, and then choose the type of fillers that can be used in that area. Understanding anatomy is a key to avoiding problems. After deciding the plane, there are three main properties to consider when selecting a dermal filler depending on the area to be treated. The first is the concentration of the hyaluronic acid or HA. As a rule of thumb, the higher the concentration of the HA, the deeper the product should be placed. For example, areas like the cheek requiring deep injections, a filler with high HA concentration is appropriate. The second factor to consider is the G' or elasticity and/or projection. Fillers with high G' maintain the shape better and are ideal for structural areas such as the chin, the nose, and the jawline. For example, in the lips, a low G' is generally preferred for first-timers or younger patients. Whereas for Russian lips, a moderate to high G' may be required to maintain the vertical definition. For mature lips, it is often best to begin with a softer filler and then consider higher concentration of HA later depending on the volume loss and the structure. And the third factor is cross-linking. More highly cross-linked fillers are firmer and take longer to integrate into the tissue. These should be injected deeper to avoid lumpiness, especially in high movement or thin skin areas. For example, skin boosters are typically injected more superficially, so they require non-cross-linked or minimally cross-linked HA with lower concentration of HA. There are special considerations in certain areas and must be treated with extra care with product selection and techniques such as the tear trough, which one has to use a low-density, low G' with minimal swelling potential. As always, refer to the manufacturer's guidelines, but understanding these principles is crucial for safe and effective results. Please like, subscribe, and comment.